Hi everyone, I'm Dr. Z, and we're going to be learning about autism. I myself am on the spectrum, considered a level 1 diagnosis, and I have a bachelor's of science in biochemistry, a doctorate in naturopathic medicine, and I practice functional medicine. Some clinical communication strategies that we can use as clinicians for neurodivergent individuals. First thing that we can do to help the neurodivergent population as healthcare providers is provide written instructions. This is clear, concise, written information to help supplement the verbal information, and this can allow for better processing abilities depending on how they can perceive, as well as allowing processing time in general for people who may have delayed processing in general. Providing visual supports. So use diagrams, use charts, use visual schedules, enhance what you're trying to teach or share through visual supports. And this will help to reduce anxiety about procedures or about what's to follow when you can provide that information in a visual format and not just a verbal one. A lot of times it just kind of gets mixed up in people's heads, and that creates a lot more anxiety. So this is something we can really do to help our neurodivergent populations. Allowing for extra processing time is really important. I'm talking about like extra processing time for verbal information and for formulating responses without interruption. And another really big thing, this is something not just for clinicians, but for your family, for your homes, for your loved ones, for your partners, really, really important hack that my partner and I figured out that's helped our relationship so much is offering choices rather than open-ended questions. And this is going to reduce decision fatigue and anxiety and leading with curiosity instead of assumptions when you do this as well. So an example of this is, for me, what works best due to my PDA is that my partner just tells me the decision and I automatically want to correct the decision or dispute it or agree to it or make a better one. For some other people, they would prefer that two choices are given to them and they get to pick which one. This is going to help so much. An example of this is like, the common complaint we get is like, nobody knows what they want to eat at night. Instead of asking your loved one, what do you want to eat at night? That's a open-ended question. Do one of two things. My preference is for someone to say, hey, we're going to eat zucchini tonight. And then I would go, yeah, that sounds good. Or no, I'd rather do da-da-da-da-da. If they ask me, what do you want to eat at night? I would have a blank in my brain. I just couldn't think of it. The other option is say, hey, do you want to eat zucchini or carrot tonight? And the person can choose. I struggle with the choice. I don't struggle if the decision is made and I have to just keep feedback on that decision. So there's a difference depending on the individual here. Another way to have a neurodiversity-affirming space is to try to partner with autistic advisors, try to guide some of these modifications through lived experience perspectives, like start to ask questions and update your clinical knowledge, not just by people who are taking care of autistic people or treating autistic people or whatever the case, like find people like myself who have experienced autism and share from that lived experience to help grow your clinical communication strategies. Creating a neurodiversity affirming space is an ongoing process. It really requires commitment to learning, adaptation, and listening to autistic voices. Some examples of creating a sensory-friendly clinical environment. Lighting. Install warm LED lights or natural daylight. Use dimmable lights or remove flickering fluorescent bulbs. Really helpful and really dysregulating for me on the spectrum. Sound. Turn off the waiting room TVs. The relief I feel in my soul just by saying that, because of how awful TVs are in some locations and you're just like forced to have to hear it. It's so bad. Minimize background noise. Offer noise canceling headphones or earplugs. Scent. Enforce a fragrance-free policy or use unscented cleaning products or air purifiers. Try to keep the room ventilated. This helps with the sensory issues that can happen there. For touch and texture, offer varied seating. So soft cushions or firm chairs, maybe providing weighted blankets or like lap pads. Another example is like providing stim toys to help with self-regulation. So like fidget spinners, squishy balls, single toys, even allowing people to have their own personal stim objects, incorporating maybe like movement breaks if they could benefit from that. Scheduling is something that can also be adapted, maybe offering the quiet hours of like the first or last appointments, or allow flexible check-in times, or allow the extension of appointment durations because many of us have time blindness. And it can look like we're being unprofessional or rude or self-serving or something of that nature, but we genuinely don't experience time in the same way. And that's a whole other topic. Some communication support could be using clear, literal language. The more information you give generally can be better. Offering AAC devices, writing options, and again, allowing for that extra processing time. There can be some art and creative outlets. You can provide art supplies, paper, markers, clay, incorporate music therapy, rhythmic activities, some sort of musical instrument, sensory rich activities like sculpting. Nutritional support, you can provide ways to assess the dietary deficiencies and then recommending broad spectrum micronutrients and collaborating with dietitians or naturopaths or functional doctors or so many healthcare providers that would really, really enjoy being a part of your team to help create sensory friendly meal plans. And then having social and emotional support, which means train your staff on neurodiversity, validate different communication styles, provide peer support groups. We must, as a society, begin to educate ourselves on the different ways that people both perceive and express their own reality. These sensory-friendly environments benefit not just autistic patients, but also those with migraines, PTSD, anxiety disorders, and so many other conditions that involve sensory sensitivities.